Hi, welcome back to my channel. So in this video I'll be talking about an important topic, which is the health planning committees in India. So this is often confusing, and usually 1 to 3 questions are asked in the exam according to this topic. So after this video hopefully you'll be able to solve all the MCQs. So I'll be talking about the sorry I'll be talking about the committee, then year, and then we'll talk about the salient features. Alright, now I misspelled committee, sorry. So yeah, so our first committee was Boer committee. Now it was proposed in the year 1946. First thing you should know is that it is also called as Health Survey and Development Committee. Alright, then it was proposed by Dr. Joseph Boer. Okay, they had two types of plans. One was short term and one was long term. Short term involved that one PHC should be set up and it should cover 40,000 population. In long term, it is also called as $3 million plan. Now in this they said that we need to establish health units and like at 3 levels. Okay, so you have primary health unit, then you have secondary health unit, and then you have regional health unit. So in regional health unit he said that there should be 25,000 bedded hospitals. Okay, and in secondary he said that there should be 650 bedded hospital, and in primary he said that there should be around 75 bedded hospital. Okay, and then he also gave the concept of social physicians, that is all the medical doctors who are undergoing the training for MBBS, they should have a 3-month PSM, that is community posting. Okay, and then he also gave the concept of comprehensive healthcare. Now you should know this a keyword, right? That is womb to tomb. That is what is comprehensive healthcare all about. So womb to tomb. Now let's talk about the second one. So in second there was Modular committee. Now it was given in 1962. Now here you should know the name. It is also called as health. Sorry, so it's called as Health Survey and Planning Committee. Now here basically they were telling that we need to have some regional assistant directors and so on, and the main thing that you should remember is that they proposed the AIHs, like you have IAS, IAPS. That's along with that they said that we need to have medical health services as civil also. So that's why. So then next one, in the next we'll talk about the Chadda committee. Now whenever you see Chadda, you have to remember CM. Okay, so basically you have to remember that they proposed the malaria eradication program. So they proposed the National Malaria Eradication Program. So it was NMEP, and it was proposed in 1963. All right, and they also told about family planning health assistant. The only drawback of this was that they proposed a concept of a basic health worker. Now this basic health worker was required to do the work of collecting the malaria records, like he was responsible for the vigilance, the collection of vital statistics, alright, as well as a family planning. So this was the drawback, that one person had to do all of this. This led to the formation of the next committee, which just had done just one thing, that was the Mukherjee committee. Now this was proposed in 1965 and it was also given in 1966. First they said that we need to de-link the National Malaria Eradication Program from family planning, because they're not related, right? And then in the next year, then after achieving this, they said that this basic health service that we are providing according to the Chadda committee, basic health service, now we need to provide it at the block level. So this is what the Mukherjee committee proposed. Alright, then coming on to the next committee was the Jangalwala committee. Now Jangalwala committee. Now this is in 1967. So you just remember that there's a one year gap in all, and in this there's a 2 year gap. Okay. So now this committee was, now there's a name for this that you should remember. This is the Committee on Integration of Health Services. Now what they said was, the many points that you should know about this. So first was that they said that there should be equal pay for equal work. Then they also proposed that there should be no private practice. Okay. And integrated health services was that they should provide a unified health service for all the problems and not segmented services for problems. Then came the next committee. Now this is a committee in which you get questions, and like you should be knowing this. So this is the Qatar committee. Now in Qatar committee, this was in 1973. Okay. Now in this you have the concept of multi-purpose workers. Okay. And then it has also a concept of auxiliary nurse midwives being replaced by female health workers, and there is a concept of male health workers also. Okay. And basically, yeah, this much is important for the Qatar committee. Then came the next committee. Now this is also like potent question only, Srivastav committee. Now this I have seen a lot of times asked, so you should just know the features nicely. So first of all, this was responsible for the medical education. Okay, that's why it's important. Then Srivastava committee, there's a very phrase for this, that they basically talk about the referral services complex. Now what do you mean by referral services complex? Now if I tell you that you have a PHC, then you have a sub PHC, and then you have a CHC, that is community. Now what happens is, the first just say the grassroots level is PHC, but the first referral unit is this one, and the second referral unit is a community right so health center. So then there's a very important that they also talk about the village health guide. They also gave the 3-tier rural infrastructure. Now what is this? In this you have the panchayat, then you have panchayat samiti, and then you have the Zilla Parishad. Alright. Now in this we've done this, and then there's also one like keyword that is asked from this is band of para professionals. Like they just ask this as the statement only, as I'm telling you, semi-professional health worker. So you can't lose marks here because this is all cramming. So see, they just ask you which committee proposed the band of paraprofessional and semi-professional health workers. So that's how you will know that it is a Srivastava committee. Then there was one more, now 2 more committees are left, so we'll just cover them. So there was Krishnan committee. Now this Krishnan committee, 1983, you need to know the years. Now there's just one thing that you will remember about this, that is urban revamping scheme. So like even if you forget, right, there's a rapper Krishna, so like Krishna. So if you know, like goes like this. So if you remember this, then like he does pop, right? So that's urban music, so that's why Krishnan. Okay. And then last committee was the Bajraj committee. Now even the examiner, if he's like, I just want to make a paper, and like this is the easiest committee, so it's basically the accumulation of all of them only. So basically what it did was, it just formulated the national medical and health education policy, and it also formulated the national health manpower policy. It also made a education commission, and it also made health. So this is the committee which basically acted a lot, like they worked a lot. So health manpower cells. So that's like 1986. So this is about the committees that you should know. Like these are the very important points that you should know about all these committees, and you can't skip even one point out of this because this is already very concise. So yeah. So if you found this video helpful, do give it a like, share, subscribe, and thanks for watching.